Welcome back. This is always the hardest time to give class or lecture because it's right after lunch. In the United States, it is nap time. So I'm going to try to keep you alert and oriented during this. And I think one way in which to keep people alert and oriented is to threaten you with the fact that on Friday, the delegates are going to do a presentation using the tools we're about to go over this afternoon. So there's added incentive to pay attention and ask questions. The other thing I would ask is if you're using a laptop for anything except taking notes, put it down, because we absolutely need your attention. We need you to participate. I never really just give a straight lecture. I always really try to get the group involved. Suraj knows this. He's been in class with me a lot. And I think this will be a lot more fun for everybody if it's interactive. If there's something I say that you don't understand, stop me. Ask me to say it again. Ask me to go slower. If there's something you say that I don't understand, I'm going to do the same thing. Okay? Good. So let me get started. We're going to talk about strategic problem solving. And this is a very important piece of this conference because we're believing that being able to solve problems is ultimately really a managerial science and a leadership skill. When we had grand strategy yesterday, they talked a lot, big picture, set the strategy, know what your objective is before you go. So I think that's very consistent with what I'm going to go through. But I also am going to try to put a few more steps in there for what you do after you have set the big objective. So let's start here. Thinking strategically. What does this mean? The way we're thinking of it, we have the circle on the left side. That's where we are today. That's the current state we're in. And we have the square on the right side. That's where we want to be. That's the desired state. That's where we wish we could be in X amount of years. And the thing that gets you from where you are today to where you want to be is your strategy. This is thinking strategically because we're defining that desired state first. So in the terms of problem solving and in the terms of what the delegates have done on your way, and we had a lot of email about this before we got here, you defined the current state and we called it the problem statement. It's the problem, it's the thing you're dealing with right now, your current state. And you also set an objective of the desired state, what you'd like to be doing relative to that problem, where you'd like to be. And our week today is to really think about how do we design, implement, and evaluate that strategy that will get us from the problem to the objective. So that's sort of the setup of where we're going. Any questions about this just before I move on? Makes sense? Ties to before? So this is the approach we're asking you to use. And it's an approach of problem solving, clearly not the only approach of problem solving. And I hope with all of your experience, a lot of this you'll say, oh yeah, that's just like something else I learned. It's not meant to be all new to you, of course. It should be logical, it should be intuitive. But I think structuring the complex problems you've brought in this way can help you and us together think in a kind of rational, logical way about complex problems, but also communicate it. We heard so much today of your job as leaders communicating what's the problem, what am I trying to do, and why am I going to do it, and did it work? That maybe these will be some tools that will help spawn that kind of power in what your own communication is. Another theme as we go through this is going to be the use of evidence. So I'm hoping that through this problem solving, we'll collectively see how often a leader, a great manager, a leader, is able to embed evidence to promote problem solving. And that, I think, is the great synergy of if we can use research evidence and evidence to change policy. It will be used if it solves problems, because that's, I think, what most people really want to be able to do. I'm going to go through each of these steps with and start to get into some examples. but you can read these here. Define the problem, state the objective, conduct a root cause analysis, develop from that possible strategies you might use, compare the strategies using common criteria, make a choice, select the strategy you're going to go with, create an implementation plan, and then create an evaluation plan. Now, right off the bat, I would imagine anybody who's done evaluation here, maybe Johnny, I don't know, you're going to say, why isn't an evaluation plan right at the top? Why not right at the first thing, do I want to know what my evaluation plan is? And I would say yes and yes. The fact is, there is some linear thought process, but there's a lot of feedback loop to say, okay, actually, I'm going to change what I really think my strategy ought to be now that I know exactly how I'm going to evaluate it. So I do not want to be so rigid as 1, 2, 3, 4, 5, 6, 7, 8. You got to do it that way. Look at it holistically. And I think as we get into the actual material, it will make more sense. Okay, so defining a problem. We won't spend too much time on this since you did an awful lot of this before getting here to this conference over the last 6 months or so. I'll never forget in the very beginning when I learned about quality improvement in the US, the experts at that time said, you got to figure out the problem in one sentence. Keep it short. The problem is. And I have found this to be tremendously helpful to focus a group, to have a group be able to communicate the problem to people above, to demonstrate greater leadership by sort of seeing the forest for the trees. The major problem is. And a primary piece of sort of defining the problem is being sure it's a problem, not a solution. Like, what would be an example of saying a problem actually in the words of a solution? Can you think of anything that you might come up with where you would, it's really not a problem you've given a solution? Any ideas? Right, start with we need. Like, the problem is we need to have a plan. The problem is we need a human resources plan. That's not really a problem. Developing a plan could be a strategy to some problem you have. And it's not really ultimately an objective, because if all we had were plans, we wouldn't have accomplished anything. That's not the desired state. We don't want to be in a state of we have a plan. We want to be in a state probably where we actually have human resource capacity. We really have enough qualified, skilled health workers. So the idea is to be sure to state the problem in a way that it's truly a problem, not the solution or the strategy you would use. Address a problem that can be feasibly solved. I think that our groups might come to terms with this over our week here, that maybe some of these problems might be narrowed in some ways so they can be feasibly solved, but that's a critical piece, I think, to managing problem solving. And choose a problem that's widely agreed upon as a problem by key constituents. And Ariel, I think, did a nice job of sort of saying, how do you advocate so something will be a problem for the key constituents? Because if Liberia wants to deal with maternal mortality, but the key constituents don't, doesn't matter how good a leader you are, not going to happen. The key constituents have to see it as a problem also. So we're starting this after that's already happened. And in fact, we tried hard to get people in the room who had been asked by their ministry or their senior leadership team to work on this problem because it was a priority for you, which was really why we didn't tell you what problem, but have you come with it. So hopefully they're already agreed upon as a key issue. So just examples in defining a problem. So the rest of the people in the room know what is going on here. Ethiopia. The problem has been defined as the lack of human resources with managerial capacity in the health delivery system with focus on hospitals. Reasonable. In Ghana, the problem has been defined as they have a lack of a method to monitor performance of healthcare managers in the health system. Now, they focused on this. They lack the method to monitor. I don't know if ultimately, as you start to work in your rooms, this problem statement will be that the healthcare managers are not as productive as we wish. I don't know if that will ultimately be it. You'll work on that, I think, with your fellow and student ambassador and yourselves as well. Liberia defined high maternal mortality ratios as their problem. Mexico, the lack of ability to tie financial payment to health providers' performance and quality. Again, I think that you have decided that you already have sort of narrowed it to, if we could tie the financial payment to performance and quality, you'd get the kind of state that you want, where you would have higher quality and higher performing providers. I think that's where Mexico was headed with this. Rwanda changed your problem statement. That's great. Flexibility is #1 in leadership, so great that you put us all to the test here. But Rwanda changed their problem statement to, we don't have enough skilled healthcare workers to meet our healthcare delivery needs. So what's sort of your reaction to these problems? Do they all feel like problems? They all feel like they're made, you can criticize. We worked hard to try to get them to actually be problems, not solutions. Is it, you're comfortable with them? Yeah.
In my view, is there a general lack of human resources, or is that inadequate? Don't you have any of all, or the one you have, you don't have sufficient?
Yeah.
Or there are not sufficient skills?
It's a good question. Let's just not answer it right this second, because we're trying to get through the pedagogy. But that's a very important thing, and that'll be part of how you sit down when you're really defining this problem to be as concrete as possible. Is the problem you don't have enough resources with managerial capacity? Is it the quality of the human resources with managerial capacity? What piece of that will it ultimately be? But they, I know, have done a lot of thinking about it. But why don't we try to get through what this approach is, and then hopefully we'll have time to talk about the specifics. So that's the first of the define the problem. The second, state the objective. So let's go through this in terms of stating the objective. First, we want to be sure the objective addresses the problem. Most times when people start this, they define one problem and then they set an objective that's fully different. So they might define the problem as high maternal mortality ratios, and then they set the objective that we need to reduce costs in the healthcare system. And what we had hoped you would do is just couple these things. And you have the opportunity to couple them, in other words, keep the problem and the objective totally linked, because you're one team doing this. So often in countries, anywhere, we see one team figures out the problem, and another team figures out the objective, and the two just don't come together at all. That's a huge problem by itself. You have the luxury of just being here in this little room, and so your problem and objective can come together. But it's a skill you can use, I think, in working in policy and practice to keep teams back focused on what's the problem that this objective actually solves, so that they are married together, a way to sort of bring forces together on a single laser beam effort that you might want. So in this place, we have kept the objective addressing the problem. Keep it short. It's the other thing. You don't want 5 pages of objectives, because again, you're all about communicating. You can't communicate 5 pages of something. Be sure it's feasible to attain, and be very specific about the objective. Who will do what by when? And of course, I think all of you have probably at one time or another studied the SMART objectives of specific, measurable, A, actionable, R, realistic, T, time-bound. Good. So being able to do that kind of work, which of course can help set off your evaluation, obviously is a very important thing. At this stage, we'll just go back to the example, each country set an objective that was not yet defined with that level of specificity, but it's the beginning, which is Ethiopia enhance the managerial capacity of human resources in the delivery system with focus on hospitals. Ghana, develop and implement an effective method to monitor human resource performance in the health system. Liberia is working on, their objective is to reduce the maternal mortality ratios by 10% by 2010. Mexico, develop and implement systems to tie financial payment to health providers' performance and quality. And last, Rwanda, develop skilled healthcare workers to meet healthcare delivery needs of Rwanda. So these are, in each case, fully married to their problems. As you work this afternoon to be sure you like the problem you've got and it's the right narrow or breadth, and you work on these to make them as specific as possible with the objectives, they might change slightly, but I think starting now at 1:35, the problem and the objective are well married with each other, which is a good thing. Any questions about this piece of it? Okay, so that's the easy part because you had done most of this before you got here. Let's go to the third step of problem solving. And incidentally, number 1 and 2 was easy because we spent a little bit, fair amount of time on it. In your countries, obviously, that's a huge political and economic discussion. It's really the priority setting, which is gigantic. And we had a lot of talks about just figuring out what priorities might be. This problem-solving method really assumes, okay, we can define a problem. Starting there, now what do we do to actually make something change? And underlying my desire to go through this as part of a leadership institute is oftentimes number 1 and 2 happen, and then we fall a little flat on 3 through 8. And we know this is a priority, we know this is what we're trying to do, we write policy papers, white papers, we have WHO meetings, we have H8 meetings, G8 meetings, everybody meets. Everybody agrees, but then actually to get through it and make a change happen is, I think, what great leadership requires. Okay, so I'm on step 3, which is conduct a root cause analysis. Of the delegates in the room, how many have done a root cause analysis? Suraj. Everybody. Okay, great, most. Okay, so our goal here was for you in your team, since you don't have that much work experience with each other, though the methodology might be straightforward, you're actually going to the workout room to do a root cause analysis of the problem you've decided to work on, is what our hope was that you would do. And so let's just talk a little bit about what we mean by root causes. What we really mean is these are the underlying reasons, and the underlying reasons for the problem itself. What are the root causes that you should focus on? That's another story, because obviously if you go out, you could come up, and I don't know if you've had this experience, with thousands of different reasons that things occur wrong, thousands of different reasons for maternal mortality, etc. The question is, how of all of that do you make way so you know which root causes to focus on? And so just a couple of criteria by which you might decide which to focus on. One root cause that you would want to focus on is the test. If I fix this, will the problem go away? That would be a great root cause to focus on. Is it something that has large impact? Is it one of the major causes? Is it feasible to do anything about it, or do you just have to live with it? And last, will it have lasting impact without causing yet another problem? And we often talk about unintended effects of interventions. Got to think about that. Will the root cause you're talking about, if you deal with it, will it have a lasting impact without causing new problems? At this point, when we think about what kinds of tools might we be able to use to do a root cause analysis, there are thousands of different tools, and you probably have gone through many of them. We were actually just focusing on 2 different tools here. The first one that we want to focus on really is sort of fishbone diagramming, or identifying all possible causes through what would basically be like a brainstorming session. And what's good about doing this? Has anybody seen a fishbone diagram before? Yeah, you've seen it. It's on your slides. Just look forward one, okay? But tell me what you think is good about doing something like that. You brainstorm, and everybody puts their ideas on the table. What's really good about that? You might be thinking causally, so that's good. Say it again. Cause and effect, yeah. And we heard, who was it who told us earlier today, you have to be curious. I like that, because it's always thinking, what's my cause? Why did this happen? How can I fix it? Okay, so one thing is you're thinking about things that are causing and having an effect. What else is good about doing this brainstorming? So it takes energy, it takes time, you gotta sit down, you gotta listen to everybody talk. What's good about it? Yeah, you just get all the options. So you're less likely to tunnel down into something that's wrong. Yeah. Anything else that you can think of that's good about it? Because then, of course, I'm going to ask you what's bad about it. Yeah. You might get some buy-in. Tell me what you mean by that, buy-in. Okay, so it's one thing where you might just be more likely to have acceptance by the people who have to implement it if actually they've helped donate the reasons for it, right? But there are probably other reasons to get all the information in. You're absolutely right about that, it'll just be easier to implement if they've been part of it. And I know here in the US we use that rationale a lot for the reason that we would include everybody. What about if you're in an environment where, no matter what, the people who you're working with aren't going to feel empowered? You're in a society where that might not happen. Is this still a good thing to do? Juliet says no. Oh, good. I like controversy. Why not, Juliet? Okay, so go ahead. Okay. So in this situation, you're saying, you brainstorm, and all of a sudden you have all this disagreement. Nobody can get consensus, and you've sort of made it worse in a way, because Pandora's box, we call it here, is put everything out, and then what you do. So certainly, this issue of brainstorming and fishbone diagramming, there is this tension between, is it Angela? Yeah, Angela. Angela's point of, well, but it'll engage everybody, and Juliet's point that, but then how do you move forward? Because people aren't really agreeing on things enough. And go ahead. What did you say? Somebody said solution. It's what? Negotiate. Then potentially you could find a way to resolve if you have the full information out. Absolutely. One thing I was going to say about this issue of what's good about getting all the information out, even if you're in a situation where participation is not the culture, is not going to happen, people feel disempowered, which is not a pleasant situation, but if you're in that situation, there's a good reason to still get all the information out, which is if you're the decision maker, you will understand better. Even if ultimately not everybody gets a voice at the table, because that's just how it is, even in that situation. If you have greater understanding, because everybody has a piece of the elephant that you're trying to see, that in itself just can make for better decision making. You're more informed. And the issue of whether it also gets buy-in is sort of an added benefit. I think Juliet's point, however, was, the second thing I'm going to talk about is that. Let me go right to the fishbone for a minute. Oh, okay. So here we have facilitates brainstorming and organizes many ideas, ensures wide engagement, to Angela's point. But to Juliet's point, it doesn't really help with prioritizing, and it can set you back instead of forward. You can actually spend 20 minutes brainstorming and come out feeling like I'm never going to get anywhere. My own view is we should still do it because it helps us understand better. But we do need some way after that to go past all the great ideas and actually start to prioritize and make decisions for action. Yeah. You want the? Hmm.
It's a little bit far from fishbone. Because brainstorming will bring out the ideas, and there are clear rules that you don't challenge what other people say.
Excellent.
So usually, what makes the fishbone even more important is when you use a fishbone diagram as maybe a second step in your analysis. The brainstorm brings the issues out, and then the next step you could probably do is to prioritize.
Great.
When you prioritize, then the third step is using the fishbone, at which point now you take a problem and then you'll be asking, if someone gives a response, you may be asking, but why this happened? So that it makes people to think further and further and further to a point where they may be exhausted, but again, it allows a lot of exchange of ideas, and people can actually be thinking, and someone talk about ownership, at that point the ownership issue comes into play. Mm-hmm. People then start to feel, yes, I'm being listened to. Mm-hmm. But if we use the fishbone diagram and link it and mix it up with brainstorming, then it gets a little bit confusing and you don't get the result you want to get.
It's a good comment. Let's go to a picture. Let's go to a fishbone diagram, just so we have sort of concrete, because the first issue you raised, Dr. Varpala, very important about is really is having a fishbone diagram the same or different as brainstorming? And you see, you brainstorm, be free, get it all out, and organize it then on a fishbone. I actually am in full agreement with you. I've, of course, seen this done in not a very prioritizing way, but just anything anyone says goes on the fishbone. That could be good or bad depending on your kind of situation. But let's take a look at it. The problem statement here, I couldn't write it all out, but what we mean here is a long wait time between emergency symptoms, let's say, onset, and actually getting emergency care, being treated. Just a long wait time. Now that could be due to thousands of things. So one could have done maybe it's a brainstorming, or maybe it's brainstorming plus prioritizing to get the picture out here. And somebody might say in the group, the reason that we have such a long time between when the person feels they need emergency, or when the symptoms come, and when they get to actually get care, is it may be because there are too few emergency service facilities around here. Or someone might say, no, there's plenty of them, but there's no transportation. Can't get there on time when we need to. Or someone else might say, actually, there's plenty of them, but when you get to the emergency department, it's so crowded and so difficult, it takes forever and you wait. Another thing someone could say at the top there, it costs too much. That's why people don't go, it costs too much. Just a couple more of these. Under equipment, you could say, well, they get there, but then when they get there, there's no equipment or medications, so they actually don't get treated. They get nothing. The last sort of domain here, people, you could have a lack of knowledgeable, lack of knowledge relative to the reasons to refer. The rural health workers may not fully have guidelines and understand the reasons to refer to an emergency facility. Or maybe the staffing in the emergency facility is not adequate. When you look at these different potentials, what comes to mind relative to this? You know, if your team had just done this, what comes to mind about your ability to move forward from this spot? Yeah, Angela. Yeah, you're just kind of overwhelmed, huh? Sort of chaotic, too, because isn't it kind of organized in a way? Well, some of this is about the facilities, and some of this is actually about community people and what they understand. Some is about the rural. Some of it's the delay from my house to the place. Some of it's from the entrance of the place to actually just all over the board. But this is not uncommon. And I think sometimes as leaders, we kind of try to close it down too early and say, oh, that's too confusing. No, don't think about that. Actually, creating some ambiguity, some flexibility, I'm just not sure which way I'm going, could potentially open us up to find creative ways in which these things work together. But we have to manage the intense complication and confusion, chaos that come from it, which I hope our Pareto diagram will help with in a moment. This issue about organizing it in the four wings, that's just, it could be any themes that you wanted. It's a method to try to organize like ideas together. Different people do it different ways. I think it can be driven by the kind of problem that you're particularly working on. Now, the issues with this, which Dr. Varpala and Angela and Juliet all raised in different ways, were, gee, is there really priority setting when you do this, or have you just sort of brainstormed, put stuff out and organized it? Maybe it gets some buy-in, but maybe it creates more confusion and lack of consensus than we really need. So my view at this point is the other piece of sort of root cause analysis that's critical is evidence now. This is a good place where data can be very helpful to have one actually decide on the priority root causes that one will eventually design strategy to overcome. Thousands and thousands of different ways to do this, different consultants to hire to run regressions and do a lot of different things. The basic sort of thought process I think has been very well informed by great thinker Pareto, and Pareto diagrams have been named to sort of quantify how often the problem, that in this case is the delay in emergency care, is due to each of the possible root causes. We would never want to have to do studies of those 40 things that were out there, but having some data about some of those root causes and how often each one is associated or is present can help us sort of identify where we are with things. And obviously there are many more complex ways to look at this. However, I think at root, when we are actually working on operational problems where we are trying to explain why we're doing what we're doing, and really that's half of leadership job, is to be able to communicate this to large audiences, don't want to get overly complex. For instance, the main concept, and actually maybe I'll ask you, what's the main concept of a Pareto diagram like this? What's the sort of main take-home point here? Besides it's simple, yeah. It's a visual. It's a visual. How big a problem is, and what do you mean by that? Like here we have perceived quality on the y-axis, the percent of the delays, if you could measure that, that is attributable to the person, the individual, really not thinking they're going to get very good care, perceived quality. We would say that if we ran a study of this, 80% of the time that was the dominant reason for the delay, if these were the data. Or maybe about 17% of the time it was because there was no transportation. And maybe 2 or 5% of the time it was perceived to do because of cost. Heaven forbid these are not real data, but it sort of gets you to, I guess, the question, John, did he leave? Where's John? Ah, John, you took your coat off. Ah, okay. And that you were asking is sort of, how do you bring evidence? And my own view of this is the kind of evidence we need to move policy is actually often pretty simple evidence. Julio Frank was here to talk about how he really used evidence to drive Mexico's adoption of its health insurance, and really said the main thing I needed to know is what percentage of the dollars were being spent by the private sector out of pocket versus not. That's not a gigantic study. That's like a Pareto diagram saying, well, how often is the care not being given due to which kind of cause? So again, I think there's many, many more sophisticated approaches to this kind of work. But at root, the benefit of a Pareto diagram is it tells you if 80% of the problem is due to that root cause, that's the place to target strategy. And so the fishbone and the Pareto diagram work in opposite directions, one sort of getting all the information out, and the Pareto maybe helping to prioritize these things. So that's the approach. Do you buy that, Dr. Varpala? Yeah? Okay, good. And if you want to go back to the fishbone after this, that would make some sense too. So let me just talk briefly about developing possible strategies. The goal for today when you go to work out in your own sessions will be to conduct a root cause analysis of the problem you've brought to work on and to start to think through developing possible strategies to get at least this far through. So I wanted to just talk a bit about what we mean by developing strategy. I guess the first thing is each strategy is going to be a set of actions. It's not going to be one action. Obviously, you have huge responsibilities in your country. So a strategy really is a set of multiple interventions that can happen. No question about that. We don't want you to think small in any way on this. Nonetheless, I think as we consider all the possible things we could do, possible strategies we could do, there's several sort of, again, criteria by which we could judge which one would make the most sense to do. So a good strategy, and I'd love to flesh this out further with your experience, but a good strategy accomplishes the objective. That's the first thing. It actually is effective. You think it will accomplish something. Again, data could be used to say, will this accomplish it? It's feasible. It recognizes interrelationships, which ties to a concept John Gaddis and Paul Kennedy raised on Monday. I don't know if that concept was apparent to everyone, but that they're interrelationships to manage. What did they call that? And they had a cool word for it. The ecology of our health system. They kept coming back to that. A great strategy has some degree of flexibility. You're sure you're going to go this way, but you have to improvise. There's no way not to improvise. This happened yesterday to us. We had great scholars here talking about history and grand strategy, and about an hour through, Leslie and I said, oh my goodness, we really have to tie this to health. And so you improvise quickly. And that, again, is a good way to go with strategy. And our last great strategy has broad stakeholder or leadership support. Are there things on here that you think have benefited, make a better strategy, a worse strategy, that sort of aren't already reflected here in your own experience? Yeah, Angela. Say it again. You have the means to do it? It's sort of, say it again. Grand strategy. Marry the means. Yes, that the means, so that's sort of what's meant by accomplish the objective. The means is going to be a good strategy, the means that you're going to use to actually accomplish the grand objective, if you will. They should be absolutely tied, yeah. Yeah, what else? Okay. Okay, so let's go back to the issue about the wait time. Again, just to pull this example through, possible strategies to address wait time. So I'm just going to take 3 for the fun of it, and they could be totally different ones, but let's pretend that we had done a study so that we knew these were potential strategies that dealt with prevalent root causes. One being implement referral guidelines to encourage rural health workers to refer patients to facilities as soon as possible. 2 being improve the roads and purchase ambulances, deal with the transportation. And 3 being enhance the quality of care in emergency facilities. Now, I tried to take these 3 only because they're easy to talk about. They're small compared to the kinds of things you're going to be working on, but we don't want to be here all day. We want to give you the time to work. So just for sake of discussion, they're a single action, each of them. But how would you decide among these? How would you decide? Maybe they're all good. How would you decide? Yeah, so you would look at criteria for each one, and you try to sort of balance them based on those criteria. Other ways in which people might think between the different strategies? What's feasible? What's feasible, which might end up being one of the criteria, but like its feasibility, yep. What else? Yeah, each strategy, pit them against each other based on cost, maybe cost effectiveness, the bang for the buck. Yeah, what else? The most results, sorry, the most results. And did you mean fastest and greatest? I thought that's where you were about to go. Absolutely. So if we go to this step 5 of comparing the strategies on common criteria, we want to, as Kare had said, use criteria to compare them and then organize your data. Again, is another place where evidence and data and research could really be used to select between strategies, because in an ideal world, you would have a litany of papers or evidence or small-scale studies that had been done to sort of say, I know this strategy, looking at the evidence, carries this cost and has this impact. That's the ideal. But of course, as leaders, you won't be doing those studies. You'll be taking that evidence from all over the place and hopefully synthesizing it for decision-making. And I guess, though this seems perhaps simple, how often we don't do it. And we were all talking about how the research evidence is over here, but actually using it to pick the strategy and make a decision, it's not done that much. I think this is sort of central for all of us in thinking about which evidence we should be getting and then how we can translate it into a decision. Yeah. Yeah.
In our case, as countries, is the influences even from partners and
Yes.
stakeholders.
Yes.
Because in each country, at the country level, each stakeholder has his or her own ideas and concerns and likeness of different strategies. And sometimes this also come into play in helping you to make a decision.
Gigantic.
I give a common example in Liberia. We were at the point of determining which strategy to use for health financing. How do we finance our healthcare delivery system? And it was a big dialogue among our international partners. USAID on one side, the World Bank on one side, DFID on one side, with the EU, and we had to just, and everybody was bringing evidence. But the good thing is that the evidence they were bringing were evidence that hadn't been used, that was not generated from Liberia. So
Yes.
they were bringing evidence from Rwanda, from Ghana. The World Bank said, okay, Ghana did a very good thing on social insurance. And so we had to stop to say, okay, we agree with you, but we want to generate our own evidence.
Mm-hmm. Yes.
We want to dig behind and see what has worked in this country, and then we will all come together and decide which way.
Yes. You've made two incredibly important points there, and let me just put all these up because we'll get to it. Some of the criteria I think already raised in the room were its effectiveness, its cost. I sort of raised its time to effect, and Dr. Varpala has raised the issue of stakeholder support. And that is absolutely critical. Now, we said political support, but that was not meant to mean literally political, small p, big P, I don't know. Your partner, your stakeholders, all of them, international, national stakeholders. I really like your second point of, so what evidence do we believe? This is a gigantic question, and I think you're absolutely right. While some of our earlier speakers put an awful lot of trust in evidence, the fact is, even though it's a statistic and there's a p-value on it, there's a lot of wobble around what the evidence says, how you frame it, how the method was done, what the measurement was, what the multivariate model looked like, what the inputs were. Enormous. We have this experience very much using the USAID model to estimate lives saved in Ethiopia over their rural initiative. And again, you're always, whoa, look at that. Okay, that's an assumption. Okay, it's an assumption. So you're absolutely right that people could bring evidence, which I think is a call for us, and you for sure, to get really good at understanding and evaluating evidence and say, this is credible to me in Liberia, or this is not credible to me in Liberia. I think the knee-jerk action of saying, no, I won't believe it unless it's done in my country, is not always that helpful because it isolates us from what actually can be learned. There's some medium there where some things are useful and then some replication in the country. But I think you're absolutely right to be a little cynical, potentially, about evidence that's given to really, or critical, evaluating whether it works or not. And in fact, if we take these criteria and then try to compare the strategies across criteria, this is nothing more than two boxes. The top box is qualitative, if you will, and the bottom box is more quantitative, but no magic at all. And on the left side, under strategies, are the three we had talked about, just to be simple: implement referral guidelines, build roads by ambulances, enhance the perceived quality of facilities. Now, so far I've sort of talked about those as being separate, and you do one, you don't do the other, you're picking which is best. Oftentimes, people come to us and say, wow, those are all great, I'll do them all. What I will do is, they all look good, I'm going to do them all. So the issue, what do you think about that? If someone goes through this and, well, actually, maybe I should describe it first, and then you can tell me what you would do. So across the top are the criteria: effectiveness, cost, time, and political support or stakeholder support. You could pick whatever criteria work for your problem. They will be different depending. Sometimes cost is not an issue. Sometimes time is not an issue, but that's really up to your teams. And this is qualitatively just talking through, for instance, the effectiveness of implementing referral guidelines. You might say, I'm not saying this is true from evidence, I'm just saying pretend you had the evidence. You might say that's low. Build roads and ambulances, you might say that's medium. Enhanced perceived quality of facilities, you might say that's high. Now, in terms of its effectiveness. Now, getting to populate that box, what do you need? You need evidence. You need studies, you need experience. You need your own experience, or good consultants that you believe in, or coaches that can provide this kind of information. What the leadership team is doing is organizing it in a way that a decision can be made. Not actually running the study, but just trying to organize these types of things. And again, on the bottom is nothing more than trying to put some numbers on these things to sort of say, well, if 3 is my best and 1 is my worst, or 3 is very good and 1 is not so good, effectiveness, the first, implement referral guidelines, its effectiveness, is low, I'm going to attribute that a 1, and et cetera, populating that box, adding up, and getting a total. So what are just some thoughts you have, reactions to this? Because I think one of the things that we're always trying to build as leaders is sort of critical thinking. So there's some great things about this, and there's some horrible things about this. So I'm curious, your own thinking it through. Reactions. John's laughing. Yeah. Mm-hmm. You mean like weighting, how heavily? Absolutely. So you could embellish it and you could weight. You could embellish it and you could, use Excel or whatever you're going to do, and you could weight these. So let's pretend we do that. Now it's still things are wrong with this. Why is that? Let's say we weight it. Yeah. Koki.
I think you might still come up with a lot of strategies that have very similar scores. So it's still going to be a choice in terms of how you select amongst that. And I've actually used a similar tool that Columbia University had developed on setting a strategic framework for setting priorities. And we ran into that when you rank several interventions and then you have scores that are very similar, then you still have a lot of back and forth with the stakeholders as to how you select the ones that you're going to work on.
Excellent. So actually this is sort of a situation like that, because 10 is awfully close to 9. Okay, maybe 6 is worse. So it's not clear. You could come out with things that are actually quite similar, or I would go so far as to add, even if they are a little bit dissimilar, it's only an aid. It sort of is just a way to organize a debate rather than tell you this is what you're going to do. Because it's like a tool, like a hearing aid, to help you sort of hear it better, but it can't actually make the full decision for you in that case, particularly in the situation where things come out very similarly. I think people who are heavily bought into this approach, however, would go back and say, well, there must be some other criteria that we could put into this to separate them. Because if they're truly all the same value, then it's sort of a coin toss on that. But yeah, so that's another issue. Other issues that you might see with this? Yeah, oh, sorry. Hi.
We're working with the assumption that the greatest value is the best option but oftentimes it might, in fact, be that you're better off with smaller, quicker wins to show results sooner and with greater impact than one big, great impact.
Good. So, and in fact, I suppose you could trick the matrix to serve you by weighting time very heavily, and having something quick means more. So you could kind of trick the math to do what you want to do, but you would need to think that through if that was really what you wanted to reflect. Absolutely. I think the other thing that for me is problematic, but again, I think it's a nice way to organize things just as decision makers and communicators, but from a research or an evidence-based problem, who knows what's inside this matrix? Why is something 3 or 2 or 1? How do you inform that? How good is that data? Is it a vote? Is it we've read the literature and this is what we think it is? You know, what do you do? And I think that you know, experts get better and better at delivering this evidence so that it can be used for this kind of decision making. But those, I think, are just some of the challenges when we cross the line from just doing a study that we can go publish to actually trying to create data that can be used in some way to make a decision for a policymaker. My takeaway from this approach is it helps a conversation. To think in terms of criteria, to think in terms of, wait, what are my alternatives and on what criteria am I evaluating them? It brings a certain rationale to the debate of what otherwise can kind of fall down into just arguing back and forth, back and forth. It brings a little more logic and evidence and rationale to it, but it certainly doesn't replace what do you think we ought to do. It's sort of super ration, which helps, but of course there's the irrational and the sort of negotiation that occurs as well. So I think it's helpful, but it's not at all a panacea. Yeah.
Might not be here at this point to consider this, but a lot of these problems, there may be many approaches and strategies occurring in the countries. And so I'm wondering if it's like here you might want to consider, you're not the only one who's coming up with that strategy, so is there a measure of, I don't know, the group, like you said, it's hard to know what that measure is, but sort of a way to track whether you think that's an area that's beneficial to join in doing or done sufficiently as an aspect of your program, or maybe there's another part of the problem solving.
You must have an example in your mind. Is there an example
I was
that...
just thinking human resources is kind of one
Good.
that a lot of these groups are, and Rwanda is tackling, and so there are a lot of strategies that others are tackling in that area.
Yes. Yep.
And so I'm just wondering, should they, you know, in doing this, actually starting to compare strategies, I guess, how do you bring in that understanding of others are doing parts of some of those strategies,
right,
or
okay.
you join with them, or?
I see. Good. So what you're saying is there are tons of different decision makers and actors and agents. And if you choose one, someone else might be choosing 2, at which point 1 is just fine because 2 is covered. I mean, I think that's what you're saying is it's your decision's synergy with what else might be going on in the country. And I think that could be brought into one of the criteria, like this augments what else is happening or is antagonistic to what else is happening. I think that would probably be the strongest place. But I mean, you are raising a very, very good point about sort of a super rational approach to this too, and a single group decision maker as opposed to multiple parties where you're almost in a game theory with each other. If they move this way, I would move that way. That said, I think you can sort of make assumptions as you go into this of what the other parties are already covering and reflect that in some of the criteria. It's a good point. Okay, I'm going to move on from where we are with the problem solving. We were here. Select the strategy. Yeah, oh, go ahead. Please, yeah.
We have used. For example, effectiveness, cost, time, and political support. I don't think that they have equal grade. probably maybe I would prefer to give effectiveness the highest grade to
The
save
highest
cost
weight.
and the highest weight. Then
Yeah.
you have to multiply the weights that you have given to each by the grade that you give to each strategy.
Yeah.
For example, if effectiveness gets 5 from 5, cost 4 from 5, times 3 from 5,
Yeah.
political support 2 from 5,
Yeah.
then I will multiply 1 by 5, then I will give the box for implement referral guidelines and
Yes.
effectiveness. So I think it will give us an unbiased
Yes.
grade, and it will be really feasible. I mean, it will facilitate the decision-making process.
Yeah.
So
Yeah.
I think we should not give equal value for effectiveness, cost, time, and so on. The other very important point that I would like to raise is that sometimes there is a situation or a scenario that you have to implement 2 or 3 strategies
Yes.
rather
Yes.
than just one strategy.
Yes, yes, very good. So both of those, let's just review them quickly. Weighting these differently is very important, and that's a value judgment and understanding that each team should work with that makes sense for them. The issue of sometimes you just got to do 2 of these. Like you might analyze this and say, they're all good, I need to do all 3 of them. If you were really going to do a comparative analysis, each of these lines would probably have multiple actions in them. Like one strategy might be, we're going to build out roads and ambulances and improve the quality of facilities. That could be a strategy. Then there'd be another one that wasn't that, because it's an alternative, something you, in other words, you want to set them up so they're alternatives to each other so you can pick the one, even if it's a composite one, that actually is better than the others. If you go through the whole thing and at the end of it say, oh, we're going to do them all, then in some way you haven't really done a comparative analysis. You've just sort of valued each one and said they're okay. You haven't thought opportunity cost. If I do this, I can't do that. But you could write each strategy as a set of interventions, which would make some sense. Okay, is it okay to go on? Okay, so problem-solving steps. So number 6, you would select the strategy, and as Koki described, you might just take the highest score, or if it doesn't make any sense, you might be using that only as a guide and then select a strategy based on some other criteria as well. One issue we didn't actually discuss very much that I think can be very helpful is you can, at this point in making the decision, you can think about some type of sensitivity analysis. For instance, I meant to say this here, if you really have no certainty over how long something will take, for instance, you could say to yourself, well, if this ended up taking a long time, so I only got a 1 on that instead of a 2 to enhance the quality of facilities, I say, I'm not sure. I think this is going to take much longer than that. You could redo this, changing that piece of information and see how it affects the outcome. In other words, since there's so much uncertainty around a lot of these things, you could do a sensitivity analysis to know if you change some of these numbers or some of these assumptions, will it change what strategy you're going to select? And that can make something a little bit more robust, potentially, and easier to communicate. So that even as people say, oh, we can't do that because it costs too much, you might say, well, no, I actually redid it even with those high costs, and it's still the thing that we want to do. Okay, so that's the end of that. To select the strategy, the only point I have there is evaluating these with qualitative and quantitative data. Listen to reason and intuition. We heard a lot about this, the issue of balancing sort of paradoxes in leadership, that it's never all reason or all intuition, but some kind of balance between these. Be clear on choice. This was just the point that we just were talking about, Dr. Yabeltel, is saying, well, we'll just do everything, is probably not having really done a comparative analysis. But really making choices is really ultimately what the leadership piece will be. So for the moment, for no better reason than it's just how the numbers worked out, an example here would be, our choice would be enhance the perceived quality of facilities. That's what we would come up with from that kind of analysis. Again, that's not at all based on data, it's just an example. So the last two steps of this are the creating an implementation plan and create evaluation plan. Again, we don't necessarily have to be doing these in perfect order, but this is where we wanted to go as well. And we're actually quite hopeful that you'll start to think through these pieces as well as you're addressing your problem. And why do you think this implementation plan part is very important or not very important? What's your reaction to actually having an implementation plan on something like these huge problems you've brought? Is this a valuable thing to do or not so valuable? It should be someone else's job. What do you think? Yeah, Suraj.
Whenever we identify the strategy, we have to have the implementation plan for that strategy. Otherwise, we will end up in getting nothing without nothing. We must have time when to accomplish that, and we must identify who is going to do what, and what resources that we are using. These all things should be identified in the first thing, so that we can evaluate at the end of the day
Okay.
whether we have achieved our objective or not.
So that's very pro-implementation plan. And I think you described this of an implementation plan, sort of having a list of the actions and the sequencing of those actions. Could be in lots of different names for it. I've chosen the name of Gantt chart. Assigning the person, you described that, who would be accountable for the task, and sort of the overall governance of the plan. A piece of the implementation plan we'll talk about in a minute is also this managing the resistance, which I think is a lot of what John Gaddis was talking about when he referred to friction. But before we get there, just going to this action plan, I know many of you have seen something like this, and I want you to think, Suraj just gave, oh yeah, you got to have one of these, you need to do something like this. I also want to talk about what happens as we do this, because I'm curious how many people have actually got something like this on some strategy you were trying to do, and actually it wasn't followed. How many people have that experience? You're lying. Everybody has that experience. The whole world has that experience. So let's first see what it is, and let's understand why we never follow them. So the implementation plan that we're talking about is on the left are the action strategies. The action items. The big strategy is enhance perceived quality of emergency facilities. That's what we said we were going to do from the comparative analysis. Now, implementing this, what are the actions that have to be taken? I have no idea whether these are the right or the wrong actions. They're just an example. But for instance, they're at a much lower level, like establish a set of clinical standards for care and quality of care measures. Develop management capacity and human resources in those facilities. Improve the supply chain for essential medicine and equipment. Establish pay for performance methods. Again, controversial, but just pretend I selected that. And 5, develop public reporting system of quality measures. The second column is, so who will do it? Who's responsible for it? And these columns, that's quarter 1, 2, 3, 4, out to 10. How they should be sequenced, who should be doing what. So how many people have this in their office? On some strategy, you all probably have an action plan that you're on, right? And what's your experience using these action plans? Suraj, it's working though, right, in Ethiopia. But Angela, you're right.
Well, first of all, we didn't begin when we said we would begin, so everything else got pushed back. And then we forgot entirely about the plan and went about doing what we needed to do as the as the intervention demanded.
Okay, so not starting when we said we would start and then not keeping to it. What are other people's experience? Same thing? Did someone just say same thing? Same, Julia? Yeah, Julie, did you want to?
Yeah, I said funding.
Funding.
If the funding is coming from a donor, sometimes they don't coincide with your action plan. Even though it has been set, you've set guidelines and everything, they might have red tapes, or if you're waiting for a TA, TA might not be available.
Good. Okay, so you might actually, you're trying to do it, but you hit a rate-limiting step. upset because somebody hasn't put the TA or had the TA proper there, or they haven't put the budget, or you've hit a block. Okay, and often when we hit a block, and we hit millions of them, we take an action plan like this and it goes on the shelf, and then we're done, because it already was off kilter from the first day. It was off kilter, and then someone else caused you a problem on step 3. Now it's really off kilter. The best thing to do is not to do that. The best thing to do is think about the action plan as a living document. You know, it's sort of like your own personal budget at home, or your own to-do list that you bring with you. It is got to be a living document that changes all the time. Because if it isn't a living document, it just goes to the shelf, and then it's never used, and then there really isn't a plan. You can't communicate it that well. You don't really have the evidence about the particular thing, and it falls into a lack of productivity. And particularly in your roles, demonstrating with informality that this is actually the approach, and it will be changed. If deadlines have to be pushed out, they get pushed out. But clearly, bringing this into, I think one of the reasons we often put it away is we haven't met it. But maybe what we should do is say, well, let's reformat it then. We made a rational decision. We delayed that. Let's do it again in a more. I think the other thing that often happens is these get really complex. They might have 800 lines on them. Project management. Gigantically complex. And clearly it's important for somebody to be keeping track of those details. But the idea of what actually you have as your big picture is critical. Yeah.
My experience has been a little bit different. In that, for the first time in the health sector in Liberia, because we were able to get a national health plan, and then we collectively met to develop an annual operational plan that everyone in the health sector knows about, and put in a very rigid monitoring process in place where every 3 months the entire health sector meets to review the performance of the last 3 months and set new targets for the following 3 months.
Right.
And also meeting every year at an agreed date together. This has helped to change things very drastically.
So it is more of a living situation that changes regularly. I mean, I guess that's the point. If these things don't change, they aren't going to be useful. Yeah. Let's go to the piece of implementation that's outside this, which is really managing the resistance to change. And just a couple of thoughts on this, and I'd like your thoughts as well. I guess the literature, as we look back to it, would say that resistance to change is absolutely expected in any problem-solving action. And in fact, the growing resistance often is a sign that the change is really starting to take place. People will actually ignore you if they don't think you're going to do anything. They're not resistant at all. They're quiet. They think, great, you're going to do pay for performance? See you later. And they're not resistant. But then you start to get the fee structures, and you actually start to do it, and all of a sudden, wow, all this resistance. And you wonder, well, I had a meeting with you about it. I told you this is what we were going to do. Why now are you resistant? But that resistance is actually a sign they're taking you seriously, that this is going to happen. It's a good sign. If somebody isn't arguing that this doesn't make sense, you maybe are not getting through to them. They maybe haven't heard because they're in the status quo. If you're bringing in change and they aren't saying, wait a minute, wait a minute, wait a minute, then maybe change isn't happening. And they're quietly going about to do it just the way they always did it while you write your pay-for-performance policies. So this idea that resistance is the time to stop is, I think, very wrong. Now, it's certainly a time to say, wait a minute, what am I doing? Am I right? Do I have my evidence? Is this really what I believe? There's no question about that. But it isn't necessarily a sign that you've made a mistake, or your team has chosen the wrong strategy, or you've used the wrong implementation. In fact, it might be a sign that really you're making some progress. So from the sort of grand strategy principles, we would want to anticipate the resistance. We'd want to know who's not going to like this, who's going to lose in this, and really develop a plan as part of the implementation plan for managing that resistance before and as it occurs, so that it doesn't seem like it comes out of nowhere, but you very much expected it, and you had kind of a plan for what you were going to do with that. And in fact, we have sort of, back to this example, not specific to emergency room waiting time, but different ways just from the literature of managing resistance. I think rather than my articulating it, I'd love to hear from you. All of you have had some of this experience managing resistance. Is there one or two key lessons learned you'd say that's been very, very successful in managing resistance? And then I'll add my list. You know what I mean by people disagreeing with you, right, about which way you're going to go. What do you do? Someone disagrees, what do you do? Yeah, Yabelta. Communicate. Communicate, communicate, communicate. Okay,
and
good.
tell them what benefits it can bring for them.
Argue it
Communicate.
benefit.
Definitely. So if you really have a very good communication strategy, definitely there will not be any reason that people will continue
Right.
resisting your strategy and so on.
Okay, let's say you communicate really well and you do everything right and you've made a really good argument that this is going to benefit you, and by a rational point of view, you just really have informed people. Why still might you have the resistance, and what do you do about it? Even if you communicate. Yeah, Sarah, or you, Ebenezer? Yeah.
Yeah, I was saying that you may have to get people who understand you and then involve the other people. I mean, there are some people who certainly will understand you. So you move along with them and then involve
you get kind of a group that understands you. Is that what you were saying? You get,
yes,
you
and
get
then you pull the
more
others
than just
along.
you. But, sorry, what?
No, because you have to develop champions. I mean, with all
champions.
these things, there must be people who, all of them should agree, but not everybody will agree. So I believe in order to push it forward,
Get a critical
you need to-
mass that see it your way. So don't
exactly.
go it alone. Yeah. Mark, yeah.
I think there are two things I would say. First of all, basic to both of them is listen. It's not a matter of one-way communication. It's a matter of two-way communication. And it may be that the person raising an issue, it's important to understand what their concerns are. Perhaps there's a way to do what you want the way you want and still address their problem. And secondly, there may be good ideas coming at this point that you haven't heard about. So it's important to be flexible and actually take those into account and maybe turn a resistor into a supporter.
Yep. And it really highlights this great paradox of having to be both at once confident, optimistic, I know where I'm going, I'm expecting the resistance, and completely flexible listening. Gee, what am I hearing, and do I need to adapt in one way or another? Leadership is hard. Yeah. Over here, Les?
Sometimes resistance comes because people feel like they didn't been involved since the very beginning. So they just resist to show that you should have been involved with them since the very beginning. So
yeah, they're just making a point.
So sometimes it's good to just assign the most resistant to some of the task to implement, or try to see how you can involve them more, and it is over. But it depends with the situation.
And of course, you're raising a great point about leadership, about engaging people who truly are different, that don't maybe believe what you believe, but engaging them into the process so that what you understand about the phenomenon is accurate, that you have all the voices represented. A phenomenal leadership thing to do, but it just pains our gut sometime to do it, right? You're doing it, oh, this is so difficult. But that, of course, I think is part of this, yeah. The thoughts, these might trigger some other thoughts that I didn't actually hear. It's a lot in the literature about developing a sense of urgency to make the changes. And again, I think this is really a critical leadership paradox in the case that somebody in the leadership role really needs to read the outside environment, see what the urgent, maybe hostile outside environment, meaning the difficulties, the fears, you know, somehow as a leader you need to call attention to people, and sometimes that's through fear. Like what's happening outside, this is what's happening. It kind of gets people alert. But then immediately you have to be able to shift to create what will be a safe learning environment on the inside. And as the leader, you're sort of the one mediating that external, scary environment that creates a sense of urgency, but then immediately, okay, now we're going to try to learn together in a safe place. And doing both of those at once is quite complex. This developing a sense of urgency, I bet somebody in this class or this group has used. There are many things we heard about this morning. Michelle's sort of talk about how the sense of urgency clicked in and then all these things could happen. So how can you use it? It should be part of the implementation plan, obviously maybe if not written out in your own minds. Developing a guiding coalition, who said that? You said that, Ebenezer. Get a group that sees it your way, that can help guide you and maybe give you criticism if you need criticism, and be the feelers out. This communicate, Dr. Yabeltel, the short-term wins, particularly the early successes. Lots of literature on that. This, to Mark's point, I think, anticipate who may lose or who may resist and negotiate. And you're absolutely right, Mark, putting that in. Listen to them, understand them, so that you can negotiate and think what it is you can offer despite the kinds of changes. What do they need to feel better about this change? And can you somehow make that need there? Yes. Dana.
A lot of times in change management, what we do is we actually use the people who may lose and negotiate and put them in the champion group, as long as they aren't too much of naysayers, because it really helps provide that, like, okay, I'm in the group who's rejecting this change, and I'm going to provide you feedback for what you can do to make the change happen.
Absolutely. Absolutely. And yeah, Koki.
Just to build on that, I think as part of the whole process, a stakeholder analysis at the outset also would help.
Yes.
So that you get to know who are your champions and who are your naysayers. And you know, you build the strategy of working with them along the way.
Yep.
And the other thing I was going to joke about it is get them fired, of course, would be the easiest thing. But I think that you sometimes just have to wait, in terms of time to,
yes.
Get some change happen when people move out of positions. Sometimes that's the reality we deal with.
I think you're right. I actually put that on the last. Just keep at it. I mean, at the end, you have to have persistence. And I guess, having heard Ariel, I would say you have to have hope and persistence. Have to always think it is doable. But none of the stuff happens quickly, or it would have happened. I mean, I guess that's the bottom line. You're doing things that are hard to do. And if they were easy, you would not be called in to do it. So just keep at it, I think, is a large piece of it. Yeah, sorry.
Yeah, it's interesting talking about this resistance. I have an experience for Rwanda when we perform IRS, indoor residual spraying in Kigali, Kigali city.
Right.
When the plan was very good.
Yeah.
And after when we started this spraying, we had more resistance. As a new idea, we tried to find out the causes of the resistance. And when we found this causes of resistance, we tried to integrate in the review of the plan. And we have increased the performance and to reduce resistance.
So what was the resistance from, and what did you do to overcome that?
There were more causes of resistance. The main resistance comes from people who deal with the business with the spraying.
the business of spraying.
Yeah, or
the
spraying.
sprayers. Okay.
And now, after we try to target specific sectors
Yeah.
with the high level of malaria,
Ah.
and at the central level, it was their business. They continue with their business.
I see.
And we try also to communicate.
Yeah, communicate what you're
and
trying
to
to
show
do.
the performance
And
and
right, the
effectiveness
data, again, the
and
data to
effectiveness,
demonstrate
yes,
you're
yes.
saving lives by
Yeah,
doing
thank
this.
you.
Absolutely. It's a great example. Let's move on, because I bet you're getting tired and it's getting a little late. We started a little late, but I think we're about where we should be. Let's move on to the last piece of this, create an evaluation plan. Again, all caveats. We should be thinking about evaluation the minute we step into the room, but you know, I thought maybe ending with it would be helpful. There's really no right one way to evaluate the impact of your strategy. Nonetheless, there are many, many, many good ways to do it. And so I do not want to pretend that this is the only way by any means whatsoever. But I was just trying to think about what really is practical. And we sit in this where you have large jobs, you have a lot of other things to do. Evaluation is critical to understand a tractable way. I mean, a way in which you can do it relatively simply and you can communicate it relatively simply. That's what we tried to focus on. So here we've really just identified process indicators and outcome indicators. And this data feedback loop issue is exactly as you had said, Emmanuel. You try to do something and then actually getting the data that helps evaluate it will just make it move even faster. Make it move even faster. So a couple of principles in specifying indicators. One I think is absolutely critical is be precise. And I guess I have a little bit of an academic hang-up about this, but you really want to be precise. What is the denominator? What is the numerator for any rate, ratio, or percent? Because how often we are quoting things even in this room, oh, we cut maternal mortality, well, we did this, our malaria rates went down by, what really are we saying? And I think providers of care, particularly as we get into pay for performance, we get into quality measures, they really, they're scientists, right? These are physicians who are caring for patients. They like the academic literature. They really want to understand what are the data on which they're being paid, the numerator and the denominator. And there's so many. It's complex, particularly without longitudinal records. It's very complex what the denominators properly might be. So be precise, one thing. Second, understand the method of measurement. Be sure as we can be, that it's reliable or comparable over time. I like the idea that we heard the Global Fund director today say they're investing in the data systems included to be able to measure some of this. Clearly, this is a very tricky spot, is how to do measurement in a sustainable way where ministries can be doing it on an ongoing way with a method that it really is reliable and can be compared over time, reducing some error or at least recognizing the kind of bias we might have. And of course, those two things are very complex, so my last principle is keep it simple. This is, I think, sort of a critical thing, again, for communication to move the data into a policy realm. We do have to limit the number of indicators we talk about to key ones, and they got to be measured well. It doesn't matter, it may be important at all kinds of levels to have many more indicators, but ultimately the ones that you're reporting are going to be ones that really have to move a population or have to move huge donor groups. In this example, process, and there's a lot of, again, gray around what is process and what is outcome, so we could have that debate. I don't know if it really gets us too far or not, ultimately what is literally the indicator you're going to use. In this example of waiting time for emergency care, we had a whole lot in the implementation plan of process measures that you could grab out of the implementation plan. Perhaps some will refer to these as monitoring indicators, et cetera. But you could say, yes, no, the standards are developed and disseminated. Wouldn't be very pleasing, because you're really trying to get to this outcome. Wouldn't be very pleasing, but it could sort of be along the way. You could say yes, no, or by some percentage you've improved staffing in the facilities. You could have a measure about we reduce stockouts, because we talked about the supply chain as being one of the paths on the way. You could say we actually, this is a larger one, we improve facility performance in its quality measures, because that's what we are trying to do. Could go even further and say we improve the public perception of emergency facilities. Could go there. Not all of those are processes or interim outcomes, because what was the final problem that we were trying to solve? If you remember, we were worried about the wait time. So I measured that. These are why this is process. These, therefore, don't really necessarily measure the actual outcome. The outcome relative to the process we are looking at would be wait time. So you could take, what percentage, and you have to think about the numerator and the denominator, but the wait time, symptom onset to actually accessing emergency care. And of course, these outcome indicators, which could be thought of right at the moment when you're setting your objectives, have to be fully in line with what your objectives are. So we're hoping, what can you accomplish in terms of evaluation plan while you're here? Our goal is you would at least think through some process measures and some outcome measures and put them forward as indicators. That's our goal, is that you would think about that, recognizing that, of course, this could become far more complex as you start to implement. Make sense to people what I'm talking about with that evaluation? Okay. Let me give a couple of conclusions, and then I'm happy to talk more about this and talk more about your actual assignment. The conclusions are, from our perspective, effective problem solving requires a very clear problem definition from the beginning. You hopefully have come close to already doing that, and a focus on the objective. So instead of getting up in the morning and saying, I really want to do X, we need to do X, instead we want to get up in the morning and say, I'm really trying to accomplish Y. What is the end that we're trying to get to? And I think that does shift. It does shift a bit how we decide what's on our to-do list. Is it driven by the outcome? I guess the second major conclusion is that data are critical at multiple points. I mean, we must have seen it in 10 points here where we really need data. And we need data in a way that is practical, that can be used and then used in analysis and then ultimately drive a decision. And the last conclusion I would make is never go it alone. And Emmanuel Yabeltel, people have talked about this, is leadership in this kind of problem solving, which is going to be very influential and involving many, many, many different people, requires strong relationships. Partnerships would be the word we heard so much this morning, with a guiding coalition that just weathers out the rough spots when there obviously will be many. So I hope from this, there's sort of a few things I'm hoping you take away from it. One, that you can maybe implement and use this sort of problem-solving approach. Again, remember, we're not terribly rigid. If you think other things would help you instead to address your problem, innovate, go for it, that's fine. But also a really strong embracing of what is data and evidence and how are the partnerships that you're making that are actually going to allow you to make the changes you want to make.